Welcome to Coffee Time with Abcadeas, the show where you might see me take a sip of my coffee here, but mainly I just kind of rant about anything and everything that interests me. Today I'm gonna kind of go on a bit of a rant about Canadian healthcare. It's today's video is a bit more disorganized than usual, mainly because I wasn't actually I was considering not even making a video today. I have some ongoing dispute with my landlord right now that I had to handle a bit of today. But I figured I know about enough about this subject, and I can probably just rant about it generally. I do have a bit of an outline here, so I am going to try to stay on topic the best I can. So, without any further ado, I'm going to start off by talking a bit about the history of healthcare in Canada, and then I'm going to go into the state our healthcare system is in today. Well, I'm not going to talk about it very much. I feel like a lot of parallels could be drawn with the NHS in Britain in terms of intentional underfunding and almost this advocacy to move towards a more privatized system. But anyways, so in Canada, obviously we didn't just start the country with universal healthcare. Healthcare wasn't really a thing back in, I believe, 1857. I want to say maybe 67 when the country was founded. It was probably 67, doing the math in my head, because I think 2017 was our 150-year anniversary. But anyways, it wasn't until about 1947 when NDP Premier Tommy Douglas of Saskatchewan actually pushed for a nationalized healthcare system, mainly making the argument that the health of our citizens and keeping them in good health is in the best interest of the country as a whole. Ironically, the second province to actually follow in Tommy Douglas's lead was Alberta with their Social Credit Party. The Social Credit Party was a bit of an interesting story. As far as I understand, obviously, I'm not old enough to have ever witnessed a social credit government, and I've only done a cursory amount of research. But there were some ideas, at least when the party was founded, that kind of leaned towards almost a universal basic income. But eventually, the party kind of devolved into a Christian nationalist party with somewhat welfare capitalist policies. So, what I mean by welfare capitalism is we're not looking at changing the system itself or the fundamental relationship of labor to capital. What we're looking at is just expanding social services, usually depending on the goodwill and charity of corporations, whether or not that's to provide extended healthcare services or coverage for their employees, to provide extra things like vacation, maternity leave, all those kind of things. Generally, welfare capitalism depends a lot more on the goodwill of the corporations rather than either a mandate or piece of legislation or even a government initiative. Well, there is kind of a mix of all those things in Canada. It is definitely the kind of direction that uh, Canada underwent, at least during the 20th century, moving towards this kind of welfare capitalist state. Eventually, in 1957, the federal Liberals put forward a bill that would offer any province offering a public health care program half of their funding. So the federal government would fund half of the program for them. The provincial government would come up with the rest. Eventually, in the 60s, the rest of the provinces kind of adopt a universal healthcare system. And, well, I'm sure this isn't the case for every single Canadian, because I'm sure there's quite a few opinions on this in general. For most Canadians, our healthcare system was always a point of pride. Canadian nationalism is this weird, or at least it used to be. It's kind of transformed into something else now, but Canadian nationalism always was this weird, liberalized version of basically just not being America, including having universal health care. Growing up as a kid, I remember. No matter what was going on in the country, no matter how bad it was, people would always make this comment like, well, at least we're not America. Like, at least we don't live down south. We don't have to deal with A, B, and C issue. And whether or not that's actually true in terms of how different Canada is from America, that was always kind of where our sense of nationalism came from. Eventually, there was a formal health act passed that basically guaranteed the reasonable access to health services without financial or other barriers. There were conditions in the bill stipulating that patients can be charged an extra fee for medically necessary services, also known as extra billing. So that bill stipulated that, say, if you gave birth to your child and you needed an epidermal, I believe it's called, is the needle that they put in the spine to kill pain. Say if you needed an epidermal, they weren't allowed to charge you extra just because you asked for that, right? And in the same sense, to me, that bill would stipulate that anything that could be considered healthcare or necessary for maintaining the health of a person should be covered. So things like dental, eyeglasses, all these things that, while they may not be immediately detrimental to health, neglecting them over the long term is going to cause more health issues and more severe versions of those initial issues it started off as. So if the whole intention of universal healthcare is supposed to be to keep Canadians healthy, it doesn't make sense that they exclude things like mental health care, dental care, vision care, prescriptions, like prescription medication. It's kind of this half-hearted effort to appease what were the more left-leaning sympathies during the 50s, 60s, 70s, and 80s, and to try to retain this sense of, I guess, free market capitalism in a way that we're still going to have independent practitioners that are free to charge their own prices, that can basically price gouge citizens. Like, I've needed my wisdom teeth taken out for about 7 years now, and I've avoided it because the quote I got on a single tooth was $3,000. So I can't imagine, now that all four of them need to be taken out, what the price I'd have to pay. It's insurmountable for me. It may not seem like a lot of money for some people, but that I'm also going to talk about in a minute. Ironically, around the time this Healthcare Act was being passed, a lot of what Canada's welfare state relied on were a lot of publicly owned crown corporations. A lot of things in Canada, from being a former British colony that didn't gain its independence through revolution, a lot of the way Canadian government and politics work are still centered around the British monarchy. Whether or not the British monarchy actually has a say in much of anything that goes on in Canada is kind of a different question. But up until her death, all court matters, even a speeding ticket, like any kind of criminal charge you would get, would be issued in the name of Her Majesty. I'm sure I'm not. His Majesty, I guess, would be the term now with King Charles, but it is always kind of centered around at least the nomenclature of the British royalty. So that's why, like, our nationally owned industries, places like Petro-Canada and Air Canada, were always called crown corporations. And now Brian Mulroney, throughout the 80s, sold off 23 out of 61 of those crown corporations, and effectively cutting the Canadian government out of all that revenue stream. So, as time goes on, there's a constant attack, especially from conservatives, but also liberals, despite the fact that they were the ones that initially passed the Canadian Health Act and helped nationalize healthcare. Despite that fact, they are also helping push towards privatized healthcare and have been helping that push for the last 2 decades or so. Started off with Harper, generally continuing to cut taxes and making less money available for social services, things like healthcare, welfare, all those types of issues. And I'm not here really to argue the veracity of social care programs. Really, I'm just here to kind of give an overview of the state that we're in and the direction we're going in Canada, just so you could be aware. Maybe you agree with the general direction we're going, but I don't think enough people are really aware of the magnitude of these changes and the direction that's happening. So basically, the state of our healthcare now is you have a couple issues. The main one being wait times. These were always an issue. I remember my mom, who lost her battle to melanoma, skin cancer. Even back, that would have been 2012, so we're talking over a decade ago. When she showed up to the emergency room with her stage 4 cancer in excruciating gut pain, it took her 5 to 6 hours to even see a doctor. So this has been a long-standing issue in Canadian healthcare for a long time, and COVID has only made it worse, getting to the point where last year the average wait time for surgeries in general averaged out, of course, over all surgeries, provinces, regions, is about 27 weeks, which is up from 11 weeks in 2019. So the COVID pandemic had a pretty dramatic effect on the hospital's ability to operate and perform surgeries. A lot of non-essential surgeries were delayed, despite some of those surgeries actually being very detrimental for the people that didn't get them. But nonetheless, there were those extended wait times. And then the second issue that we have is, because of the welfare state and the way it's been built up to this point, there has been a freeze, a stagnation per se of those supports, particularly the Ontario. I might be using the wrong acronym here, but the ODSP, I believe, is their disability benefit. It is pitiful. You're looking at $900, maybe $1,000 a month in a province where most of the cities, you can't even get a bachelor apartment for less than $1,500 a month. And what that has resulted in is disabled people voicing their concerns, voicing their complaints, usually around a financial issue, that they're not getting enough funding, that they won't be able to find housing, that some critical piece of equipment that enables them to perform their daily activities of living, that is taking too long or it's too expensive for them to afford. And the solution they're being offered in a lot of these situations is medically assisted death. This idea, this policy, I've talked to some disabled Canadians on this issue, and they view it as a fundamental right for themselves to make that decision, at the very least, when their pain and suffering is intolerable and living is more excruciating than death would be. And I definitely can sympathize with that and understand that perspective and wanting to have that right there. But what this has resulted in the long term, like you see here, disabled Canadian Army veteran Paralympian blasts government for offering to euthanize her when she complained about how long it was taking to install a stair lift at her home. And now, usually I'm not one to be sensationalist and take a single newspaper headline and be like, oh, look at the state of our healthcare. But this isn't the first time I've seen this at all. I've seen several TikToks. Laugh at me for using TikTok all you want. Feel free. But I've seen several TikToks of disabled Canadians in almost this exact same circumstance. Maybe it's not a stair lift. Maybe it has to do with not being able to find affordable housing. Maybe it has to do with a wait time issue or some other issue. But the solution to their problems that they're being offered is medically assisted death. Government euthanization. It seems like a good experiment, at least in terms of welfare capitalism, that if you can funnel the least profitable, the least exploitable section of the population, the disabled section of the population, if you can funnel them into an option where they can volunteer to disappear and no longer become your issue, well, that might work out really well for a government that's trying to cut costs as much as possible. And we look at things that Danielle Smith is doing, things that Doug Ford are doing, and while they aren't directly moving into a privatized system, they're definitely making a lot of moves towards that. Danielle Smith said she's not going to wait for the federal government's approval to move forward with her health care plan. And a lot of people would say, oh, well, that's great. She's standing up for Alberta. She's fighting for a good deal. But the issue is according to that Canada Health Act, if you don't follow certain stipulations put forward by the federal government, you lose their 50% of funding. So by doing this rebellious action to set Alberta apart and show and prove our independence, she's cutting the healthcare budget literally in half. And outside of what she actually wants to do, like I'm gonna post a link to this down below, but there was basically this big conservative think piece, and Danielle Smith was saying we've gotten past the point where healthcare can be paid for 100% by taxpayers, which I think is a very interesting choice of words, because other than the situation where you're talking a millionaire or a billionaire that has avoided taxes through charitable donations and all these tax loopholes, unless you're talking about that individual that is paying for all or part of their care, no matter what, a taxpayer is paying for the healthcare. If someone is going to the hospital and they have to pay 50% of their surgery, if they are being expected to pay that, they're making enough money to pay taxes. Because the weird thing about Canadian conservatism is even when it pushes a little further to the right, there's usually exceptions made for the extremely impoverished. Like we still, with our dental care, we still have several programs that are geared towards people who are under the poverty line to help them get discounted or subsidized dental care services. But so in Danielle Smith's projection, in her likely plan that she has been so vague about that we haven't really seen anything firm in writing about yet, she's making this insinuation that it's not going to be, we can't 100% pay for it with the taxpayer dollars, which obviously she is correct. She's making the point that we can't pay for not correct, but she's making the point that we can't continue to use tax dollars to pay for all of healthcare, but she's trying to make it seem like this is costing you, the Canadian, and the way I'm doing it is not going to cost you, the Canadian. And I guess overall, if you want to make the argument that you're a generally healthy person that doesn't run into any health issues, and you're paying for a bunch of people that have made poor life decisions, I guess I could understand that line of thinking. But then also when you come into your old age and you do need medical services, are you willing to pay an arm and a leg, like tens of thousands, if not hundreds of thousands of dollars to have those services? And it's not like private care automatically means better outcomes. In Canada, the worst results during the COVID pandemic in long-term care facilities, I don't care what you think about COVID in vaccines, in terms of the number of deaths, the highest number of deaths were in private care facilities opposed to public care facilities that had far less deaths. The thing is about privatization, any private corporation, any publicly traded, especially private corporation, as I mentioned previously in my videos, the CEOs and the important financial decision makers of the company are under a legal obligation to optimize profits to the nth degree, to the largest scale that they can. And this is why no matter who you work for, their objective is to get you to do as much work as possible for as little pay possible. And your objective as a worker should be to do as the least amount of work possible for the most amount of pay possible. That's just what's in the best interests of both parties. So when you carry this over to a healthcare provider, they want to spend the least amount of time on a patient, charge them the most amount of money possible, pay the doctors the least amount of money possible, and have the most efficient system they can, even if that doesn't mean actually resolving health issues, but actually moving them further down the road so people require more intensive, more expensive surgeries. So instead of taking care of the issue right then and there, getting early testing done, they're going to provide a solution like prescription medication, or seeing another specialist, something that's going to kick the can down the road so they can continue to make more and more and more money. Obviously, at first, what's happening with a lot of this, like with Doug Ford moving to open up more private surgery clinics, like don't get me wrong, this is already kind of how healthcare functions in Canada. Like you may have semi-private clinics that will receive public funding, but then they will refer you to private companies. I can't even. Envision is one of them, and then Data Line, I think maybe I'm slightly getting that wrong, but like imaging companies, companies that do X-ray scans, companies that do blood tests and stool analysis, those are all typically private companies. So it is already kind of melded into this semi-private, semi-public system, but as we continue down that road and premiers like Doug Ford continue to add in private healthcare services, they get to turn around and say, oh, well, look at these turnaround times in private healthcare facilities. And for those private companies, it's in their best interest in the short term to give the best care possible and reduce wait times, so they can make the argument, or at least the conservative premiers can make the argument that, see, private care is so much better. We should just make the whole system private. And as more and more Canadians continue to agree with that line of reasoning, we end up in a situation 10, 20, 30 years down the road where we're back where we started, where wait times aren't that much better because fundamentally wait times have to do more so with the organization of our system. Like just to give you an example here, this is a study of healthcare wait times by country by the worldpopulationreview.com. I've downloaded it and put it into a Google Sheets doc just to make it a bit easier for everybody to read as well as myself, and to help point out some statistics here. And while there are a lot of factors like density, we look at, so Canada is in the red, the US is in the yellow, and then particularly these three countries, Germany, Netherlands, and Switzerland. To my knowledge, they all have public nationalized healthcare. Correct me if I'm wrong. They may be a little similar to Canada in terms of some services being public, some being private. But when we look at the actual wait times for each one of these countries, so Germany, Germany, the Netherlands, and Switzerland don't have median wait times for all the surgeries. But when we look at, I believe this is for just a specialist, so the median wait time for a specialist, it is 61 days in Canada, which is a really long time, and only 27 days in America, so about half that. But you look at other countries that also have nationalized healthcare, and they actually have shorter wait times. So it's not an inalienable fact that private system equals shorter wait times, because ultimately it boils down to the amount of people in an area that can be serviced by one hospital, or how many smaller clinics need to be opened. Obviously, only so many people need foot surgery, for example. It's not feasible to hire a foot surgeon for every town and village. But then you also have kind of bundled into that just bureaucracy, general bloat, I guess, more so you could call it. I've spent some time in the healthcare system. Like I said, my mom spent some time in the healthcare system. And there are so many unnecessary people, procedures, extra things that get printed and sent and faxed still. Like, it blows my mind how anybody is using a fax machine in the year 2023. But that is still a common practice in the healthcare world. But at the end of the day, even privatizing these services isn't going to automatically fix our wait time issue. It may fix it in the short term, but in the long term, most likely it's going to go right back to where it was. And the only difference is going to be is now, instead of getting cancer, having to wait and then fight out the cancer, you have to get the cancer, wait, fight out the cancer, and then most likely sell your house and declare bankruptcy to afford the treatments. I don't understand how that's a better solution for anybody other than rich people. And what doesn't make sense to me about that is most rich people will actually go down to the States to get their surgeries done, especially if it's an elective surgery. So our current system still works for those kinds of people, anyways. And you look at most people, the majority of Canadians, people that are making under $100,000, even if we move to this system that's semi privatized and semi public, where a public free option is available, all the funds are going to be diverted to private clinics that have better outcomes, that have lesser costs, they're more optimized. So you're going to see a situation where public healthcare continues to get worse and worse and worse until Canadians are fed up to the point that they say, you know what? Fuck it. Let's just privatize the system. And that's similar to what's been happening in Canada for the last 4 decades, where we moved towards privatization, taking away these crown corporations and moving towards a more Americanized system. And the only way we're not like America, which baffles my mind, that I'm going to cover this in another video. I just need to do some more research. But we are the polar opposite on gun control. Even as these privatized measures are put in, the liberals specifically are pushing for more gun control that is pretty ridiculous. Like, we've had maybe 3 mass shootings in the history of Canada, one of which was related to like a political party kidnapping senators, and the amount of gun crime that happens in Canada is negligible, especially compared to the States. But we actually own more guns per capita because we're a more rural country. People hunt. There's cultural implications there with the indigenous population. Like, these gun control measures aren't doing anything for anybody. And even the party that's left of the Liberals, the NDP, are criticizing the Liberals for this. Like I said, I'm gonna get more into this in the next video I do about Canadian politics and economy. But it's just so weird that we're replicating the States in so many ways. Like, you even see Albertans, particularly in province I live in, Alberta, people pushing for Trumpian style politics and economics. And my opinion on Trump aside, it's just kind of wild to see, from growing up and watching Canadians be so proud to not be Americans, to watch them shift into almost this envy and embarrassment that we are Canadians and that we have these collectivist values, or we had these collectivist values. I personally, growing up in Alberta, never witnessed those collectivist values. Alberta is a unique beast that most people don't come here for the sights or to be close to their family or to live a happy life. They come here to make money. And they come here to make a lot of money. And if you aren't working 60 hours a week, making $50 an hour just like they are, you're less of a human being. You are just a piece of trash if you're not willing to absolutely sell your body, mind, and soul to a corporation so you can buy a big truck and a big house. So maybe it's just my tainted perception, but the only place I've seen that collectivist attitude that I've seen talked about a lot in literature about the history of Canadian politics, the only place I have truly seen that collectivist attitude is in Newfoundland. The province my dad is from, and I like to say that I'm from because I'm quite honestly almost embarrassed about being an Albertan. That is the only province that not only has its own unique culture, but has this sense of collectivism, that they care for one another. There's a very infamous story that during the 9/11 incidents, while most of the airports in the country were shut down, several Americans actually landed in St. John's, Newfoundland, and of course, over the course of the next few days, flights weren't readily available. So Newfoundlanders, Newfies, took a lot of these Americans into their home and treated them as if they were family. And even in Alberta, like I'm saying, that concept, that idea is completely foreign to me, but the Newfoundlanders made such an impression on the Americans that a lot of these Americans actually end up going back to Newfoundland, if not every year, every second year for vacation, just because they love the people and the culture so much. But really, outside of that, I've only really lived in Alberta and spent some time in BC. But even in BC, a province that's supposed to be a bit more left-leaning, a bit more collectivist in the sense, I didn't really feel that same sense of collectivism from people even living in a small town. Not living, but staying in a small town. I did get a bit of that. Like the locals at the bar kind of all knew each other, but you get the same thing in Alberta. Like, it seems like the one thing that unifies Canadians more than anything else is alcoholism. Like, no matter what side of the political spectrum you land on, we can all get together and get shit faced drunk and have a good time. And not that that's, for me, something to be proud of. Like, alcoholism amongst your population is actually a huge issue, and also why our healthcare outcomes are so bad is because Canadians make such poor health decisions like alcohol, nicotine, tobacco, fatty foods. Like, I can't comment on it because I'm guilty of a lot of those same uh, vices myself. But as a result, we have more and more people needing healthcare, more and more people diagnosed with lung cancer and type 2 diabetes, that it almost seems like a better investment rather than privatizing the system. A better investment would be putting it directly into educational, leisure, and different good health motivating programs. I'm probably phrasing that wrong, but you get my point. Like, even during the COVID pandemic, I didn't understand why there was almost no talk of how eating healthy, getting regular exercise, and just maintaining a healthy lifestyle can help fight COVID better than most other methods. Masks, wiping things down, vaccines, all that kind of stuff. Because at the end of the day, if you catch COVID, it's your immune system fighting it. I'm not anti-vaccine, but I'm also not making a pro-vaccine argument. All I'm saying is I don't understand why that's not a conversation in healthcare. Like, we're seeing now, there's a couple articles saying Canadians should move their or should adjust their alcohol consumption down to 2 drinks a week. And based on the visceral reaction from that, Canadians are definitely alcoholics. Like, I was just at the airport not too long ago to pick up my dad, and in the airport bathroom, there was a mostly empty beer can. I just thought it was hilarious. Like, there's a million places to buy alcohol in the airport to sit down and have a drink, and still someone felt the need to bring in a canned beer and drink it because they couldn't handle the 15-minute walk and check in from their car through security. Like, but anyways, these are just some thoughts I had on Canadian healthcare. I'm not really trying to argue any kind of political position. I'm just trying to argue the idea that privatizing doesn't automatically make things better. That's actually what's helped ruin our economy to the point it is. Alberta, especially, when we found oil, our provincial government, our federal government, for whatever reason, didn't want to make as much of an investment as they really needed to. So instead, they looked at foreign corporations and foreign companies that could help fund these initiatives and projects. As a result, most of Canadian oil companies, most of the oil sold out of Canada isn't sold by Canadian corporations, which is, it just seems like asinine to me. But at the end of the day, it's what is most profitable, what is the most cost effective, what offers the largest ROI, the largest return on investment. And even the Canadian government, if it can't justify a large investment, typically it's very difficult for it to make that large investment. Somehow that was thrown out during the COVID pandemic with the CERB and other COVID supports we got. But nonetheless, I think my overall point is Canada is heading in a bad direction. Things are only going to get worse and worse and worse, and no amount of conservative padding or fancy talking is really going to get us out of the direction we're going in as a country. And I'm sure some people are more than happy about that they want to eliminate the government entirely. But I'm sure a lot of people would also be terrified to think that if one day they need an abortion or they need to give birth to a child, that they need to decide between selling their car, remortgaging their house, or just doing it in their fucking living room. Like, that seems like a very not first world type of scenario. Like, this is a daily scenario in the United States. People are dying not because they can't access healthcare or because they have to wait, but because they can't afford healthcare. They fear inside their very core the medical bills that will come from getting their medical issues addressed. And this is why people are found with preventable healthcare conditions or curable healthcare conditions that are just found dead, or they just die in their bed in their home because they don't want to burden their family and still lose the battle anyways. Like, what a terrible decision. Like, you just got cancer, but if you're gonna have a chance of fighting cancer, you have to destroy your family's entire financial future, or you could just die. And according to Danielle Smith, getting cancer is a choice, right? You make a willing choice to get cancer. It's not like cancer cells just develop in organisms in general. Like, no, that's a human choice. Just, I'm sure, like Danielle Smith would argue, like being gay or being transgender, I'm sure those are all just a choice to Danielle Smith. But it turns out, if you do choose to get cancer, Danielle Smith wants you to go fuck yourself. And I don't think an NDP government, a Rachel Notley government, or a Liberal government would be any better. Don't get me wrong. They are all moving towards this direction. You see a little fight back from the NDP now and then, but they all walk lockstep with the Canadian state. This is what Canada was intended to be. This is how it was founded to be, was a country led primarily by corporations, but that just gave a bit more to their citizens so they'd be a bit more happy about it. We still had to fight violent riots to get things like an 8-day work week back in the 20s, like the telegraphic strikes, the miner strikes, the borderline civil war that happened in southern Alberta during that period, the 10s and 20s. We had to fight for our rights just as much as the Americans did, but Canada was formed with this notion that it takes care of its people, and now we've completely moved away from that, and it's just corporations control everything, which was basically the case before. And that's the case under Liberal, under Conservative, under NDP government. Don't be under the illusion that once Trudeau is kicked out of office, that everything in Canada is just going to go back to normal. The economy is going to recover, inflation is going to go away, because guess what? Trudeau's not in charge of America, Britain, France, Germany, Australia, New Zealand, all these other places that are facing massive inflation crises. Many of them are facing crises and issues with their healthcare system. Trudeau isn't in charge of those. He didn't make those decisions. Similar neoliberals and neoconservatives made similar decisions that Trudeau and the prime ministers before him have made, but he's not making the decisions for the entire planet. And he is not solely at fault for everything that's happened in Canada. I don't like Trudeau. Don't get me wrong. I'm not an advocate or a supporter of him, but I just want to dispel the illusion, at least in part here, kind of summarizing my video. Showing up to a booth every 4 years and checking off a box and then praying that that person will do the things that they need to save your life and your well-being. It doesn't sound like democracy, but mainly it isn't actually going to resolve any issue. Those people are going to do what's in their best interests, what are in their political donors' best interests, and no amount of selecting a different name in that box and praying about a different candidate for those 4 years is going to change that. That is not democracy. That is not how democracy was ever intended. The amount of people that are under this impression that Trudeau has changed something fundamentally about Canada, I would really love to see their reasoning and them break it down with sources and specific policies and specific points. But at the end of the day, the things Trudeau is doing aren't any different than what Harper did before him, or Mulroney, or Trudeau's father, or Kachin. None of these former prime ministers, fundamentally, the class interests they have don't change because of their political color. So, that's it for me today. There's a bit of a rant. I'm sure I said some things that were a bit nonsensical and could have been a little more for could have been formulated a little better, just like that sentence. But like I said before, it's just in my interest to get one of these videos done every day. Like I said, I wasn't even going to do one today, but I'm like, you know what? I'm going to sit down and rant for 45 minutes and then click upload. So fuck it. Why not? But anyways, that is it for me today. You'll see me again tomorrow ranting on some other topic, I'm sure. But other than that, have a gooder.